You might be taking one of these medications every day and have no idea it's quietly increasing your risk of a heart attack. Millions of older adults rely on prescription and over-the-counter meds to manage everything from arthritis to acid reflux. But what if some of these so-called solutions are doing more harm than good? In this video, we're revealing 6 commonly used medications that have been linked to increased cardiovascular risk, including strokes, heart attacks, and irregular rhythms. Some of these drugs are probably in your cabinet right now. If staying healthy and avoiding a trip to the ER is important to you, hit that subscribe button and turn on notifications. We break down the risks they don't always tell you about. Let's start with a medication millions of people over 50 take without a second thought. 1. Proton pump inhibitors, PPEs, e.g., Prilosec, Nexium, omeprazole. They're marketed as safe and effective solutions for acid reflux, heartburn, and GERD. And for short-term relief, they work. But when used long-term, which many older adults do, PPIs come with some hidden consequences. Studies have shown that these drugs may reduce nitric oxide in the lining of blood vessels, impairing circulation and raising blood pressure. That's not all. PPIs have also been tied to low magnesium levels, which can trigger dangerous heart arrhythmias. One large-scale study even found an increased risk of stroke and heart attack, especially in older patients or those with pre-existing heart conditions. And here's the kicker. Many people take these medications daily for years without realizing they were only meant for short-term use. So what's the alternative? H2 blockers like famotidine, Pepcid, may offer relief with fewer cardiovascular risks. Even better, lifestyle adjustments, like avoiding late-night meals or reducing spicy foods, can make a major difference. But if you're managing joint pain or arthritis with this next common med, it might be time to read the label more closely. 2 NSAIDs, ibuprofen, naproxen, diclofenac, e.g. Advil, Aleve. They're in nearly every medicine cabinet. Non-steroidal anti-inflammatory drugs, or NSAIDs, are widely used for pain, inflammation, and fever. But here's what many people don't realize. NSAIDs can increase your risk of heart attack or stroke in just the first few weeks of use. These medications work by blocking enzymes, COX-1 and COX-2, that produce prostaglandins, molecules involved in inflammation and blood flow. Blocking these enzymes disrupts the delicate balance in your cardiovascular system, leading to blood clots, high blood pressure, and vessel constriction. Some NSAIDs are worse than others. For example, diclofenac has been associated with higher heart risk than naproxen, which is often considered safer. Even the FDA warns that the risk applies to both prescription and over-the-counter versions, and that longer use or higher doses make the risk worse. Doctors recommend using NSAIDs at the lowest possible dose for the shortest time. And if you have heart disease, discussing other pain relief options first. If you're finding this helpful so far, go ahead and tap the like button. It really helps more people discover these important health tips. Now let's look at a diabetes medication that stirred major controversy and still raises questions to this day. 3. Rosiglitazone, a diabetes drug you should know about. Rosiglitazone, sold under names like Avandia, was once celebrated for improving blood sugar control in people with type 2 diabetes. But things took a turn when a 2007 study revealed a 43% increase in heart attacks among users. That number sent shockwaves through the medical community. While it improves insulin sensitivity by targeting genes involved in fat and glucose metabolism, it also alters fluid retention and cholesterol levels, which may burden the heart, especially in older adults with existing cardiovascular risks. Even though the FDA later allowed the drug back on the market under stricter monitoring, many doctors now avoid prescribing it altogether. Safer alternatives exist, especially for patients already managing high blood pressure, heart disease, or cholesterol. If you're on this medication, it's worth asking your doctor about the risks and your options. But diabetes isn't the only condition with medications that carry cardiovascular baggage. Some mental health meds can do the same. 4. Antidepressants, TCAs and certain SSRIs. Antidepressants can be life-changing, but not all are created equal when it comes to heart health. Tricyclic antidepressants, TCAs, like amitriptyline and nortriptyline, are older medications that work by increasing serotonin and norepinephrine levels. But they also affect the heart by slowing conduction and altering heart rhythms. Side effects can include low blood pressure, dizziness, fast heart rate, or even arrhythmias like ventricular tachycardia. For seniors, that's a serious concern. SSRIs such as fluoxetine, Prozac, or citalopram, Celexa, are generally safer but not without risks. High doses of citalopram, for example, have been associated with QT prolongation, a heart rhythm issue that can lead to torsades de pointes, a rare but dangerous arrhythmia. The FDA even recommends limiting the dose in older adults. If you're taking antidepressants and also managing heart disease, make sure your provider is monitoring your heart, especially if you're on a TCA. Now let's talk about a cold remedy millions reach for during allergy season, but few realize its hidden danger. 5. Pseudoephedrine, the hidden risk in cold medicine. Pseudoephedrine is a decongestant found in many cold and allergy medications. It works by constricting blood vessels in the nasal passages to relieve congestion, but it doesn't stop there. This same action can cause vasoconstriction throughout the body, raising blood pressure and heart rate. It also increases the workload on the heart, a potential danger for anyone with hypertension, arrhythmias, or heart disease. There have even been reports linking pseudoephedrine to heart attacks and strokes, especially in older adults or people taking other cardiovascular medications. It can also interact with beta blockers and MAO inhibitors, making the side effects even more unpredictable. If you're reaching for a cold medicine, make sure to read the ingredients. Safer options are available, and your pharmacist can help guide you. And finally, the number one thing you can do after watching this video: these medications, from heartburn relief to common painkillers, may seem harmless, but over time they can silently increase your risk of a heart attack. That doesn't mean you should stop taking any of them without talking to your doctor, but it does mean you should be informed. Ask questions, request alternatives, and don't let common fool you into thinking safe. Which of these surprised you the most? Drop a comment below and let us know. If you want to stay ahead of hidden health risks and get tips that actually matter, hit that subscribe button and turn on notifications. We break down the facts in a way anyone can understand. No medical degree required. Stay informed, stay healthy, and we'll see you in the next video.